The state of Texas is sending medical supplies and personnel to Amarillo and Lubbock this weekend. It's an effort to help tackle a spike in COVID-19 cases and hospitalizations. The state already sent extra resources to El Paso Monday. KXAN's Wes Rappaport has more details on the state's response.
I'm going to tell you right now, we're in a bad spot.
We're seeing that case count increase significantly every day. Over the last few days, we've seen at least 200 cases per day.
COVID-19 hospitalizations reached nearly 15% in the Panhandle and the South Plains. That's sparked the state to send in help, including more than 250 people this weekend, as well as personal protective equipment and hospital supplies.
If we can provide more staff that can provide care for COVID patients in those areas, it just helps make sure that people can get hospital care for anything that they need, even as we see more and more people seeking care for COVID-19 in El Paso and the Panhandle areas in general.
The El Paso region is on the receiving end of 2 million face masks for area schools and another 2 million for local hospitals. The mayor rolled back business occupancy this week due to the rising hospitalization rate. The state sent about 100 extra medical workers there too.
We will continue to surge resources to the El Paso region till the time that El Paso has COVID contained.
These climbing cases, a sign this pandemic is not over in Texas.
We have been optimistic for the last couple of months, and things have certainly been improving, but we've started to see a bit of a reversal in that now. We just need folks to kind of recognize and realize that that this thing isn't over yet.
Wes Rappaport, KXAN News.
The state hasn't pinpointed a single clear reason for all the spikes, but state health leaders say factors include people interacting closely without wearing masks, like at family gatherings and sporting events. State health leaders are also looking at possibly setting up alternative hospital sites should facilities become overwhelmed. Today's the deadline for states to submit their first COVID-19 vaccine distribution plan to the CDC.
It's by no means set in stone at that point. There's still a lot of things we don't know about vaccine. First and foremost, we don't know when it's going to arrive. We don't know how much is going to be made available nationally or to Texas at this point. And it really is contingent, of course, on the trials that are ongoing now.
That spokesman for the Texas Department of State Health Services says Texas normally receives 10% of vaccine allocations from the federal government based on population. He expects that to be the same this time around. He says the current state plan calls for healthcare providers and people at higher risk of infection or complications from COVID-19 to be the first to receive the vaccines. Those on the front lines working in essential services are also expected to have a chance to get the vaccine first.